we would see more governmental entities stepping up and mandating vaccines, more businesses doing so if the FDA gave full approval for these vaccines? And if so, should they be speeding up the process?
Well, it's important for people to understand, first of all, that there is plenty of data out there that shows these vaccines are safe and efficacious. What I've been told at this point, both from people inside the government and from experts outside the government, is that the FDA right now is mostly focused on making sure they can manufacture large amounts of these vaccines safely before they get to full approval. Now, that's important. It's important for the FDA to do it right. It's also important for the FDA to prioritize this issue over and above what else is going on, because I've heard many businesses, hospitals say that they are hesitant to mandate these vaccines until they are fully licensed. You even heard the US military say that they will not mandate these vaccines until they are fully licensed. So an entity that the President of the United States has control over right now is not mandating vaccines because they're not fully licensed. It's incredibly important for that reason. People talk about hesitancy. I don't know that this will have much of an impact from a hesitancy standpoint. I think some of the people out there who are truly resistant are going to be resistant no matter what the FDA says or does. But I do know from a legal standpoint, businesses and organizations will move to mandate, and a lot of them will do so quickly. And the quickest way you ramp up vaccinations is if we can get full licensure for these vaccines from the FDA.
So what should the role right now be of the CDC, Dr. Adams? You've talked about how you see schools, institutions, businesses perhaps taking the lead in implementing some of these vaccine mandates. But where does the CDC come in terms of communicating clear messaging? And I do want to point out that you have said that at the beginning of this pandemic, you and Dr. Fauci famously advised against mask wearing, and that you regret that. You felt those statements were premature. But you've been critical of the CDC just this year of their messaging and trying to get clarity to Americans as to what they should be doing. What is their role?
Well, the CDC's role is to provide national level guidance based on the best current science. And we need to help people understand, number one, that science isn't about a final destination, a final answer. Science is a journey. It's about always looking to figure out, is there a new way? Is there a better way to do things? Has the information that we based prior decisions on changed? And that happened to me when I was advising the public. That's happened with the CDC. When that happens, you have to be honest. You have to be transparent. You have to say either, look, we made a mistake, we misjudged, or the information that we were basing that prior advice on changed. So that's the CDC's role. And I think they need to be a little bit more forthcoming, more transparent. They need to move a little bit quicker, quite frankly, because they're not moving at the pace of this virus. And so they're saying things that conflict with what people are seeing on the ground. When you look at the fact that people who have been vaccinated are able to transmit this virus, that's one example of where the CDC guidance was lagging behind what people were seeing with their own eyes, and that hurts your credibility. Practically, I think the CDC needs to help us understand what a smart, intelligent, and practical testing strategy looks like moving forward. And I've called for that because last year we didn't have testing, Libby. We were struggling to stand up testing. Now we've got plenty of testing, but it's down 75, 80% from what it was in December. And one way we can safely open, in addition to vaccine mandates or vaccine verifications, is making sure we're testing people when they're coming in and out, making sure we're doing surveillance testing to catch new surges in new places. And that's what I think the CDC should be focused on: transparent communication, making sure you're giving people practical guidance based on the newest science so that they can implement it at a local level.